Hi, everyone. My name is Sridevi Rajeeve. I am an assistant attending physician in the multiple myeloma and cell therapy service at Memorial Sloan Kettering Cancer Center in New York City. So today I will be talking a little bit about the advances of immunotherapy in multiple myeloma in 2023. This is a very exciting phase in multiple myeloma with multiple drug approvals since the past 3 years, and I'm excited to summarize it for you and talk a little bit more. So just to give a brief refresher or an overview of multiple myeloma is the second most common blood cancer, and it is caused due to an abnormal number of plasma cells in the bone marrow that interferes with normal functions. Plasma cells are a specific type of white blood cells that produce antibodies that I'm sure all of you have heard of. Antibodies help protect against infections, but they also help keep cancer in check. However, when the very cells that produce these antibodies turn cancerous or become malignant, and they multiply so much so that they occupy the entire bone marrow, crowding out the normal cells, that is what is called as multiple myeloma. Because of all this crowding that happens in the bone marrow, which is the factory of all blood cells, patients who end up developing multiple myeloma can have anemia. They can end up having kidney injury because the abnormal plasma cells produce a large quantity of proteins or antibodies, and these antibodies go and clog the kidneys, and they can have kidney injury. These antibodies, although they are designed to fight infections, when produced by a cancer cell, they are very redundant. They're non-functional. So they just accumulate in your blood and cause nothing but damage. So because they keep accumulating in the blood and are not doing what they're supposed to be doing, which is fighting infections, it lowers your immunity. So persons with multiple myeloma usually have low immunity as well. And because mostly multiple myeloma originates in the bone marrow, it affects the integrity of the bone, leading you to have fractures, holes in the bones, and also dangerously high calcium levels. Multiple myeloma at this time in 2023 is considered incurable, which means that you have to have a continuous therapy to keep the disease away. It's considered highly treatable, but it's not considered curable as some other cancers are. So this is an overview of what exactly multiple myeloma is. What is the landscape of immunotherapy in multiple myeloma? Now, immunotherapy is a type of treatment that uses a person's own immune system to help kill cancer cells instead of directly killing cancer cells like traditional chemotherapy. Now, there are a few types of immunotherapy, and specifically to myeloma, we have these broad categories called as targeted antibodies, as well as adoptive T-cell therapy. Among the targeted antibodies, you have what is called as monoclonal antibodies, which means these are antibodies that are directed against one particular antigen. An antigen is nothing but a protein. So these are antibodies that latch on to a bad protein of the cancer cell and then activates it to kill itself. So that is a monoclonal antibody. There are certain targets that have been FDA approved. There are many that are still being developed, but I'm only here showing the ones that have been FDA approved. The first target is called CD38. So a monoclonal antibody that's against CD38 is called daratumumab or isatuximab. There's also another target on the myeloma cell called SLAMF7. A monoclonal antibody that's directed against SLAMF7 is called elotuzumab, and this has also been approved. Now, these drugs have been around and we've been using them for quite some time, but what's more exciting is what's happened in the past few years, and that's the development of bispecific antibodies. Now, monoclonal antibodies was only latching onto that one site, and that's that bad protein on the cancer cell. Bispecific antibodies, on the other hand, are designed in such a way that they will latch onto one antigen on the cancer cell and the other antigen on the body's own T cell. So you can imagine like a Y-shaped antibody with two hooks. One is hooking onto the cancer cell, the other is hooking onto the body's own T cell. So it brings the body's own immune cell in connection with the cancer cell, and it enables the body to kill the cancer cell. And that's the cool aspect of bispecific antibodies. The antigen on the T cell that a bispecific antibody always latches on is called CD3. And the drug that combines CD3 of a T cell and BCMA, B cell maturation antigen on a cancer cell, is called teclistamab, and most recently, elranatamab has also been approved. Another bispecific antibody that combines CD3 on the body's T cells and GPRC5D on the myeloma cell is called talquetamab. Talquetamab was also approved earlier this year. Adoptive T cell therapy is the other broad category I was alluding to before, and that comprises of CAR T therapy, of which ide-cel and cilta-cel have been FDA approved. And we'll talk about all these in detail. However, for the purposes of talking about the advances in immunotherapy in 2023, I will be focusing only on the bispecific antibodies and CAR T cells.